can be managed at home. 2% of the cases, of course, require to be hospitalized. They require the antiviral drug. They require the test also. 2 antiviral agents are available, oseltamivir and zanamivir. Oseltamivir is commercially available as Tamiflu. This is a neuraminidase inhibitor. We know that there is a neuraminidase receptor on the virion, on the viral particle. Okay, and this neuraminidase inhibitor or NAI decreases the release of the viruses from the infected cells, and thus the viral spread into the other parts of the respiratory epithelium, into the other persons in the community. So these must be administered within 48 hours of the onset of symptoms. Beyond that, the benefit is not going to be much. These NAIs or the antiviral agent reduce the length of illness by an average of 1.5 to a maximum of 2.5 days. Most importantly, they reduce the transmission. The duration of administration of NAI or oseltamivir, Tamiflu, is 5 days. Post-exposure prophylaxis to be initiated within 7 days of exposure and continued for at least 10 days for those people who are nursing or treating patients of H1N1 or who are high-risk patients who are contacts of an index case at home. This is available Tamiflu as 30 milligrams, 45 milligrams and 75 milligrams oral capsules, and as dry powder for suspension containing 12 milligrams per ml after reconstitution. The dosage pattern is given in the next slide. Who are the cases who require Tamiflu? Those who are category B and category C, and not for category A. What is the dosage of Tamiflu, oseltamivir? Adult dose is 75 milligrams per oral twice a day for 5 days, 10 capsules, 5 days, 2 times a day, 75 milligram capsule. Prophylaxis for contacts and for those who treat and nurse H1N1 patients, 75 milligrams orally once a day for 10 days from the time of exposure. Pediatric dose, acute illness in children less than 1 year, for less than 3 months, 12 milligrams per oral BID, 3 to 5 milligrams, 20 milligrams per oral BID for 5 days, 6 to 11 months, 25 milligrams per oral BID for 5 days. Okay. Now, acute illness and age more than 1 year, 15 milligrams, less than 15 kilograms, 30 milligrams per oral BID for 5 days, 15 to 23 kilograms body weight, 45 milligrams BID for 5 days orally, and 23 to 40 kilograms, 60 milligrams BID orally for 5 days. Children who weigh more than 40 kilograms, they require the same dose of as adults, 75 milligrams BID orally for 5 days. This is the dosage pattern for oseltamivir or Tamiflu. Remember, Tamiflu is not yet available for private practitioners in the public market. We have to go to the government institution where the drug is supplied free of cost in the government institutions. The second antiviral agent which is effective against H1N1 flu is zanamivir. Zanamivir is available as Relenja. It is also a neuraminidase inhibitor, decreases the release of virions from the infected cells and thus reduces the viral spread. Must be administered within the first 2 days. The adult dose of zanamivir for treatment of acute cases is 10 milligrams of inhaled powder orally BID for 5 days. It is available as discs to be inhaled just like the asthma medicines. The prophylaxis of household contacts is 10 milligrams inhaled orally once a day for 10 days. Prophylaxis for community outbreaks, 10 milligrams inhaled orally for 28 days. Pediatric dose treatment for acute illness less than 7 years, zanamivir is not indicated. More than 7 years or equal to 7 years, the adult dose, same adult dose of 10 milligrams BID inhaled through the disc-haler. Remember, both zanamivir and Tamiflu, both zanamivir and oseltamivir, Relenja and Tamiflu are category C drugs in pregnancy. So, category C drugs means the risk and benefit ratio to be weighed, and pregnancy is not an absolute contraindication. And if at all we decide to give an antiviral agent, it is preferable to give the aerosol type, that is the powder type, to be inhaled, that is the Janamivir and not Tamiflu in pregnant women. This picture shows the two antiviral formulations, Tamiflu, oseltamivir. Oseltamivir 75 milligrams available as each capsule. We have to give 10 capsules for a period of 5 days, 1 BID. Relenja is available as a discaler, and it's in 10 milligram doses each one, BID for 5 days. This is Relenja. Then of course is the question, how do we manage severe disease of category C who are admitted in the hospitals? Most cases do not need test, Tamiflu or hospitalization. That is category A. Supportive treatment and home isolation will suffice in 90% of the cases. Watch out for the high risk groups and categorize them into B or C depending on the severity. C category means they have severe symptoms like chest pain, shortness of breath, fall of blood pressure, and then bluish nails and things like that, which are already explained. Early administration of Tamiflu is indicated. It reduces viremia. Monitor oxygen saturation and maintain 90 to 92% saturation. Oxygen therapy is essential for these patients. Antibiotics, of course, are required for secondary bacterial pneumonias that develop over the H1N1 flu, and these are as per the guidelines of community acquired pneumonia or CAP. Methicillin resistant Staphylococcus aureus infections are common in these people who are admitted and who are on ventilators, and they have to be specially treated with MRSA sensitive types of drugs, broad spectrum antibiotics. Ventilator support is required in severely ill patients, and remember, ventilator associated pneumonias called VAP and VAP are quite common in these patients, and they have to be treated very vigorously. Vasopressors will be required for these patients because there will be fall of blood pressure and shock. There is no role for corticosteroids in a case of H1N1 in any stage A, B or C unless and otherwise the patient is in shock. The risk is increased by the administration of either oral or inhaled or intramuscular corticosteroids. Acute respiratory distress syndrome develops, and this is the one which kills most of the patients who are very sick. Lung protective mechanical ventilation and other intensive measures of taking care of ARDS have to be instituted to manage these patients.